Wow, this lecture is so long that I have to do a part 2. So we left off in part 1 at documentation of immunizations. So let's talk about that. So the National Childhood Vaccine Act states that a parent or guardian must be provided with a copy of the Vaccine Information Statement, or the VIS form. And this is something that you must do every time prior to the administration of the immunization. And working in pediatrics, this is something that was very prevalent in my job because we did so many vaccinations a day. So you go through this with the parent and you make sure that they understand. Then the documentation that must be included is the date, the vaccination route and site, the vaccine type, the manufacturer, also the lot number and expiration date, and then under name, address, title of person administering vaccine, that's usually in the EHR. So when you do your documentation, the name and address of your clinic will already be in there, and then you will sign with your name and title. And then documentation of delivery of the VIS, which states that you had given the parent the VIS form. And then also with vaccines, we need a consent form. So all of those things need to be documented. Why is a permanent vaccination record important? Some of you may have the old yellow vaccination reports, as well as if you go to any of your electronic health records at your physician's office, they might be printing those out. But these ensure that people, especially children, receive the appropriate immunizations. It helps to avoid over-vaccination, reduces the risk of possible hypersensitivity reactions, and it also allows the CDC to track vaccines by lot number and by manufacturer and make possible links to any adverse reactions that are going on. So here on table 6.2, these are select agents that provide activity or active immunity, and it's very important that you teach the parents the need for the vaccination for the child. So they need to understand and feel comfortable with that. Do you have any creative ideas about how you would discuss compliance with the vaccination regulation with a parent who's hesitant to have their child vaccinated? This will happen very often. So think about that. If you have any ideas, shoot me an email and let me know what those ideas are. And also adverse effects, like the measles, mumps, rubella, the MMR vaccine may have on a pregnant woman and those who might become pregnant within 3 months of immunization. They may have that adverse effect, so we would not be administering that unless there are sometimes very special circumstances, but in general you would not. All right. So agents for artificial active immunity, this is still table 16.2, the select agents. And it's important to note, I mentioned this at the very beginning of the lecture, but polio is one of the diseases that has all but been eradicated because of the routine vaccinations of young children. And there are lots of different documentaries and things that you can watch regarding different countries and the spread of polio and smallpox and how that vaccination has been very important in eradicating the polio and smallpox. All right, still on table 16.2. Let me ask you, what are some of the differences in the effects from immunizations using a live attenuated virus versus an inactivated agent? What do you think? So live attenuated viruses give the person a mild subclinical form of the disease to produce the immunity. So they get a very, very mild form. That's why sometimes you'll hear with the flu vaccine, for example, that a patient has had a mild form of the flu after getting the live vaccine. Inactivated means that that live has been killed. Okay, so the bacteriologic agents are safer, but they're also shorter acting and require revaccination for continued protection. So here's an image of chickenpox. Have you had chickenpox before? Chickenpox is the varicella virus, and we have a varicella virus vaccine. One is Varivax, and it has not become a requirement in some states for admission to school. Therefore, do you know if it is required in the state of California? Which individuals should not receive the Varivax? It would be those with hypersensitivity to gelatin, neomycin, or components of the vaccine. Immunosuppressed patients should also not receive the vaccine. Those with active untreated tuberculosis or those with febrile infections. Febrile means fever. So if we have an infection that is presenting with a fever, we would not give the chickenpox vaccine at that time. Person with neoplasm of the bone marrow or lymphatic system, and pregnant women or those who may be pregnant within the next 3 months should also not receive the chickenpox vaccine, which I talked about in an earlier slide. Now we're looking at 16.2 again, the select agents that provide active immunity. What are some of the reasons that would indicate the need for an adult to receive the tetanus vaccine or booster shot? So if a person had had fewer than 3 doses of that vaccine, or a person has had the proper schedule of the 3 or more doses but had not had the booster in more than 10 years, also a person who has a severe or dirty wound who has not had a tetanus immunization in the last 5 years would all receive the tetanus vaccine in those cases. So that is some of the reasons that would indicate the need for an adult to have a tetanus vaccine. And who should receive the pneumococcal vaccine? Persons over the age of 50, persons with chronic illness, persons abusing alcohol, as well as persons with Hodgkin's disease or persons in residential settings such as schools, nursing homes, and others like that. Agents for artificial passive immunity, vaccine and performed antibodies found in immune globulins. Protection is immediate and protection persists for only a short period of time. So there is possibility of adverse reactions, which is decreased with the use of the immune globulins. Immune globulins for specific conditions, for example, RhoGAM. This prevents the hemolytic disease in the infant whose Rh negative mother has been exposed to Rh positive fetus. In this case, I am Rh negative, so both times that I had my babies, I had to have the RhoGAM shot in order to protect them in case they were Rh positive babies. What circumstances relating delivery would indicate the use of RhoGAM? So a Rho-immune human globulin, or RhoGAM, is an antibody preparation used to desensitize the Rh negative mothers after delivery of the Rh positive infant, and it must be administered within 72 hours after that delivery. There are some dangers of Rh negative mothers giving birth to the second Rh positive child. So the antibodies produced can cause erythroblastosis fetalis in the second infant. Okay, so again, that is the erythroblastosis fetalis in the second infant is something that could be caused in the RhoGAM after the first baby has been born. Okay. Immunosuppressants. Agents that interfere with normal reactions of immune system to an antigen, like Organ transplantations, immunosuppression, adverse reactions are nausea, vomiting, decrease in blood cells, depression of bone marrow, and immunosuppressants are essential in preventing of organ rejection following an organ transplant. So that's why we have to look at that whenever we're looking at organ transplants. Otherwise, tissue destruction and rejection of the transplant organ would occur. It's important that patient education is done correctly when doing anything regarding the immunosuppressants and anytime the immunosuppressants are used. Now, immunostimulants. This is a relatively new field. The first medication was available around, I think, 1980s. And made possible with better understanding of DNA. So as our DNA understanding advances, the immunostimulants also. The most common side effects are flu-like symptoms, fever, nausea, and diarrhea. So I think there might be some more to come as we advance in immunostimulants. This concludes our long lecture for today. I hope that it was very helpful. If you have any questions, make sure that you use that question and answer board or send me an email. Don't forget that I did ask a question during this PowerPoint. So if you send me an email with your answer on that, there might be a virtual ticket. Have a great day. See you later.